Thank you, Bree. I want to welcome everyone joining us today. My name is Linnea Forsyth. I'm the Executive Director at the Governor's Commission on Disability. I am happy to introduce that we are joined today by Nathan Gom, the Executive Director of the Commission for the Deaf and Hard of Hearing, Greg Trapp, the Executive Director of the Commission for the Blind, Secretary Katrina Hotram Lopez of the Aging and Long-Term Services Department, and the Executive Director of the Developmental Disabilities Planning Council, soon to be the Developmental Disabilities Council, Allison McCoy. Today we want to discuss the successes of our collective advocacy in improving vaccine access for people with disabilities. It is really important that we emphasize that equity for people with disabilities is not just about distribution, but it's about dismantling the physical and communication access barriers in the vaccine process. So we absolutely have more work to do. We're working on this every day, but we want to highlight some of the efforts some of our efforts to improve accessibility that the state disability agencies here could not have accomplished without our partners, advocates, and people living with disabilities. So some of the things that we've been able to accomplish are in the realm of vaccine eligibility. So expanding the 1B priority group to include individuals with intellectual and developmental disabilities. Improving the registration process, so adding homebound transportation and accommodation questions so we know more about what type of support people need. Changing the signature box on the online medical questionnaire from an actual signature to a checkbox, which is something that Director Trapp was critical in achieving. And then to improvements in just getting shots into arms. So UNM, the Department of Health, Aging is actively reaching out to people who need more support to see what they can set up in terms of transportation and accommodation so people can get to vaccine sites. Launching the pilot with Sunvan so that we can transport people with disabilities to vaccine sites. As well as the home vaccine pilots that the Aging and Long-Term Services Department have been able to launch, which is really phenomenal. And then lastly, just to making the actual sites accessible. We have been working closely with a few sites in the Albuquerque and Santa Fe area to provide technical assistance and guidance about physical access, assistive technology, and communication, and have seen great success, and we hope to really expand those efforts as well. So these are just some of our efforts, but really I want to turn it over to my colleagues so that they can highlight what they've been working on too, and some of the barriers and also accomplishments for their communities. So I will turn things over now to Greg Trapp, the Executive Director of the Commission for the Blind. Greg.
Director Forsyth, thank you so much. Appreciate that. One of the things that I think that New Mexico has done, which is really fantastic, is to make our vaccine registration page accessible to persons who are blind and visually impaired. In most states, that's not the case. If you're a blind individual such as myself or my wife, you're not able to independently register for the vaccine. My wife will be getting the vaccine later this afternoon, her second dose, and she was able to independently go in, sign up for, do the questionnaire, and all the steps needed to get the vaccine. So I really, really appreciate the webpage developers, the state of New Mexico. It's something we can be especially proud of here in New Mexico. Same thing is true with the vaccine information page. That's also accessible to people who use screen reader technologies, which is what those of us who are blind do. And the same kind of technology that we use actually, I think, makes it easier for other persons to use, such as the checkbox that was being talked about earlier. That can be a little bit confusing if you're having to enter a signature to get in the block, to know exactly how to do that. But a simple checkbox works really well for everyone. So appreciate that. And Linnea, I'll hand it back to you.
Thank you, Director Trapp. You make a really good point that many of these things that we're working on in terms of accessibility, not just help people with disabilities, but others in our community as well. Okay, next I'm going to go to Nathan Gong, who is the Executive Director of the Commission for the Deaf and Hard of Hearing. Nathan.
Thank you for your time. As you said, I'm the Executive Director for the Commission for the Deaf and Hard of Hearing here in New Mexico. And one of the biggest things that we've seen throughout this entire pandemic is how our quality of life changes really do have a positive impact on the overall access to a lot of these resources. So I think Director Trapp's point was very well taken, that that simple checkbox really does help a lot of individuals. And in the same vein, when we address the needs of the deaf, hard of hearing, deaf, blind, speech disabled individuals in our community, we really do see a positive outcome for the rest of the community. Good case in point, a lot of people don't normally maybe use captions, or maybe they have a situation where they run into somebody and they see a mask and they're like, wow, I can't really understand that person. And those are hearing individuals. And then they're able to see maybe a checklist or a box or a visual indication that they can utilize to tell them what's happening. That's the result of something like our advocacy that changes that dynamic. And something I want to point out for deaf and hard of hearing community in particular is it's very difficult to hear things on the radio, watch things on TV, especially when things are captioned, and understand what's going on. So a lot of the work that the Commission for the Deaf and Hard of Hearing has been doing is in relation to getting the word out. I think Director Forsyth pointed out shots in the arms. We want to get people who want the vaccine, who feel they need it, able to get it. So we have done over 50 videos with American Sign Language captioning, explaining things ranging from the red to green framework to where they can get a shot and what the portal looks like. We've been able to work with different partners, including the Department of Health, to make sure that we get accessibility kits that are developed not just for right now, for this pandemic, for the future, when any emergencies happen. We've been able to see a kind of change in the approach to making sure that we can register, inform the community that, okay, I'm deaf, I need this, I have a hearing loss, I need this, and connect them to the right points of contact in various sites. We've had great success. To kind of segue into that is this Friday, we're going to have this huge event where deafblind, deaf plus, deaf seniors are going to be transported. They're going to have support service providers, which is going to be provided by Community Outreach Program for the Deaf here in New Mexico. It's a local organization that's a vendor of the state. And they're going to be transporting and providing interpreter accommodations for this community, in particular this Friday at the Presbyterian ALOS site. That's a good example of coordinating, getting something done that addresses our most vulnerable population. And we're real excited that the state continues to push and work together to make these events successful for our entire community. So with that, thank you, and Director Forsyth.
Thank you, Director Gom. I just want to point out, having someone like Director Gom involved in kind of anything that we do, but for instance, in this press conference, he helped make this press conference accessible, and so we appreciate that. I am a hearing person, but I really appreciate the captions, so thank you. And now I will turn it over to Alice Lou McCoy, the Executive Director of the Developmental Disabilities Planning Council. Alice.
Thank you, Director Forsyth. I want to highlight that New Mexico is truly exceptional in the way that we work together. There has been cross-agency collaboration from the very beginning of the pandemic, and it's no different here in the vaccine effort. I'm going to give you an example. For example, many DD councils, developmental disability councils across the nation have talked about various issues, eligibility in the early stages of the vaccine rollout, transportation, other kinds of accessibility issues, and they have had problems communicating with their state agencies who are doing these vaccine rollouts, whereas we here in New Mexico, from the very beginning, worked together. In fact, we had a core group of access and functional needs agencies across the state, including everybody that you see here at this press conference. We've been meeting every week at least once a week, sometimes 2 or more times a week, for months, working through a lot of these different issues. And so, I really want to emphasize and highlights that, we have a great group working together here. And we had our eligibility very early on for folks living with DD included. It's something as simple as a drop-down menu when you can identify, I'm a person living with DD. I am a person who's eligible for the vaccine. That makes all the difference. And as soon as we made that change, there were efforts to get the information out. We had a press release done. We've been posting it on websites, social media, and we did it across all the different agencies to make sure that we were getting the word out. And so I want to emphasize that, if there is something that you need to know about, or that you need us to know about, or some issues that you need us to solve, please let us know. If you contact any one of us, you're basically talking to all of us. We continue to see issues in rural areas, especially vaccine sites that may not be well-versed in dealing with different kinds of disabilities or access issues. We're still working through those issues. I have a great example. Last night in Las Cruces, we had some folks who are deaf, and we're going to have some issues today at a Las Cruces vaccine site. Immediately contacted a couple of us, and then we were all on board. We're fixing it today. And so it moves as quickly as that. So please utilize us. And if you have any issues, let us know. Thank you.
Thank you, Director Lou McCoy. Yes, I appreciate you mentioning that, because we absolutely want to hear if there are problems. We're very good at problem solving. And last but certainly not least, Secretary Hotram Lopez from the Aging and Long-Term Services Department. I will turn it over to you.
And thank you, Linnea, and to the members of the media joining us today. I have to say, I'm really proud of my team. They've pivoted and a vast amount of their duties are now really towards either testing or vaccines or making sure that we help the most vulnerable folks in our community. They continue to work tirelessly to ensure that we're getting the COVID vaccine to anyone, especially in these rural populations. The Aging and Long-Term Services Department not only serves seniors, which is very important to note, but we also are in charge of serving adults with disabilities. And my team has been doing amazing work with the Aging Network and senior centers across the state to coordinate vaccine clinics, and we prioritize seniors and individuals with disabilities. To date, we've hosted more than 50 clinics and have vaccinated more than 19,000 people. We've been able to increase our capacity to the point where we're now getting 5,000 to 6,000 vaccines allocated directly to our specialty populations every week from the Department of Health. As we continue to focus on our specialty populations who are the most vulnerable, we also work with getting these individuals who are homebound vaccinated. And that's really critical and important too. In the past Tuesday, we announced a pilot program with Presbyterian Hospital where we're vaccinating their homebound members. We plan to not only expand this pilot program, but reach out to the other managed care organizations to identify and assist us in vaccinating these most vulnerable folks. Approximately to date, we've vaccinated over 1,000 homebound individuals in our community, and more is to come. And we look forward to our future partnerships. In addition to these vaccine efforts, we've also been working with our sister departments to provide support through our Aging and Long-Term Services Disability Resource Center. This is our call center, and for the past 2 months, they have been reassigned from their other duties, like making sure we enroll everyone in Medicare, to also, and giving out resources in the community, but to also registering individuals who cannot register themselves to get the vaccine. We have been calling, I think we've called 15,000 individuals to date, and we have registered over 3,000 individuals who needed that assistance. We're very proud of that. If you need help with registrations or you've got a question, please do not hesitate to call our resource center at 1-800-432-2080. And for individuals who do not have transportation to the vaccine site, we have been working with the University of New Mexico Community Health Division, and they have been phenomenal at assisting us in coordinating transportation and getting individuals' needs met so that they can not only get vaccinated, but live more independently in the community. Again, me accrediting or giving credit to my team, we're just a small department, but we've vaccinated a great deal of individuals. We are so proud to be part of this effort and want to commit that our sites of vaccines will be ADA compliant and meet the needs of individuals who are the most vulnerable but need to be vaccinated. So we're so honored to be part of this group of champions and tireless advocates. So thank you, Linnea, for including me. Nathan, Greg, and Alice, thank you for your passion and dedication. I'm proud of what our state has accomplished and look forward to doing more and working with you all. Back to you, Linnea.
Thank you, Secretary. And we, goodness, so appreciate your team reaching out, getting boots on the ground, getting shots in arms. It's the kind of action that we love to see. So thank you. And so thank you everyone else for joining us today. As you can see, we're excited about the progress that we've made so far. We continue to advocate and continue to work through problems that we see and that people bring to our attention. So thank you again for being here.
So now we're going to go ahead and open it up for media questions. Thank you to all of our speakers. If anyone has any questions, they're welcome to either send me a chat or raise your hand on Zoom, and then you can unmute yourself and ask your question. Rick Nathanson, I feel like you always have questions.
Yes, I do. Can you hear me?
Yes, we can.
Right, Brianna, the only, I'm not clear how the how it works with getting information online to people who are blind or have hearing impairments. How does that work?
And unfortunately, Greg hung up, but I don't know if one of our other members could chime in about accessibility. Okay, go ahead, Nathan.
So it's kind of a dual track approach. So sometimes there are videos and content that's already created. And so we step in and we talk with the people who created that video, and we or document, and we talk about, can you add captions? This is how to add captions. Most everyone on this call knows one thing about me, is that I'll be very happy to explain the technology and how to add something to something. There's always a way, there's always a process. For our videos, what we did was, in American Sign Language is not an exact language translation of English. There's a lot of nuance, there's a lot of linguistic complexity in American Sign Language. So having somebody say something doesn't necessarily translate, or it's not a transliteration of what is said. It is a very much a dynamic and expressive language. So we do a lot of videos where we explain the process in American Sign Language, which involves expounding on certain topics and providing context to information that maybe we don't normally think about. And when we do that, we keep in mind that there are people who cannot necessarily see what we're saying. So we provide a visual transcript of everything that we've said in a manner that explains what you saw on the camera. So for example, there are 6 people on screen right now. Jessica is the ASL interpreter. She is a woman signing. She is wearing a blue blazer, because people do like context. They do like knowing what someone looks like. Nathan is dressed, he has a suit jacket on, a tie. Those are things we put in the visual transcript to give somebody an idea of what exactly we're talking about when we're talking about it. We also reference things. We don't just show it, we also type it out in a transcript or on a script. Those type of things provide context for the deaf community, or the deaf blind community, or the hearing community who may want to read something. Maybe they can't quite catch everything that's said and they want to read it themselves in their time. Those type of tools help when we're talking about an online video or presentation. when we do that, we inevitably open it up for everybody to have access, which is a great thing. So that's what we've been doing. We've been doing that since this pandemic started. We keep advising different groups, and I know that I think Director McCoy already said we work together. So a lot of times we just bounce off each other, and subject matter experts pop up and explain their process, and that's how those videos get done. Now, we'd like to see that across the board, and we'll keep working towards that. Greg, I see you joined in. I don't know if you caught the question or not, but
I did.
Okay.
I did. So for persons who are blind, we use technology that either enlarges the screen, or we use what are called screen readers that speak out loud to us what's on the screen. So that, in order for that to work, the web page has to be properly written and properly developed, and that's not always done. But here in New Mexico, the web page has been written in such a way that a blind person using a screen reader can access and enter his or her own information. So it's really great that blind people can independently enter information into the vaccine registration webpage and use it and do that independently.
Thank you so
And
much.
I'll just pop on really fast to add that, you know, we all know that in this state we have internet accessibility issues. And so, you know, we're very much cognizant of that. And so for folks who may not have access to the website or whatever videos we're posting online, we are doing what we can in print press, on TV, on the radio. We're trying to be in all media to let folks know, you know, where they can get registered, how they can get registered. They, you know, the easy registration, of course, is online, but you can also call it in. You can call the ADRC, you can call the Department of Health directly. And so we are trying our best to be accessible in all the ways that we can.
Thank you. Great timing, Greg. That was perfect. Any other questions from the media joining us today? Okay, looks like you guys answered everything. Thank you so much for everyone that's here for joining us. Thank you to the media outlets for your coverage of this important topic. I'm going to go ahead and stop recording.